fourth-year student in Far Eastern University. One of the subjects included in my course is medical entomology. I was lucky enough that my professor in this class happened to be an expert in the field. Dr. Pag-ong shared a lot about insects in his class, and one of the topics we focused on are the mosquitoes. To share with you a little backstory about myself, when I was 12 years old, like any other kid likes to do, I spent most of my time hanging around outside in parks. One day, I was struck with an awful fever with rashes that made my body temperature so high my mom rushed into the hospital. There we learned that I got dengue. Thankfully, I survived that. However, just 2 years later, I got rashes the second time around. I thought that it was dengue once again, but then it seemed quite different. Another rush to the hospital, and there we learned what it was. It was chikungunya. Both of these diseases are transmitted by 2 types of mosquitoes. So after those experiences, I was sure mosquitoes hated me. Now, mosquitoes comprise around 3,530 species, all contained in the family Culicidae, and is divided into 3 subfamilies: Toxorictinae, Culicidae, and Anopheline. In this video, we are only going to focus on Anophelines for us to learn about their external morphology, life cycle, medical importance, along with the control methods for this mosquito. Join me, Mary Catherine Angelica Lacap, as I share them with you. Anopheles mosquitoes consist about 484 species that are distributed worldwide. They can be found in both tropical and temperate regions. So yes, since we are in a tropical country, they are present in the Philippines. They are classified under 3 genera: Anopheline, Culicidae, and order Diptera. But only the genus Anopheles is considered medically important. Since there are a lot of mosquito species, morphological features are important to differentiate one from the other. Anopheles eggs are laid singly and consequently lie parallel to the water surface. They have air-filled floats which help them float on the water surface. Dorsally, tergal plate and paired palmate hairs are present on most abdominal segments. Pupal abdominal segments have numerous short setae, and segments 2 to 7 or 3 to 7 have in addition short peg-like spines which are absent in culicines. Most Anopheles mosquitoes also have spotted wings that are dark, and pale scales are arranged in small blocks or areas on the wings. Dorsal and ventral surfaces of the abdomen are almost or entirely devoid of uppressed scales. In both sexes, the palps are about as long as the proboscis, and in males but not in females, they are enlarged, that is clogged apically. Phew! That is quite a long list of characteristics, but these are important to properly identify the species. Now, let's move on to their life cycle. Anopheles lay 50 to 200 small brown or blackish boat-shaped eggs on the water surface. I know, it is a lot of eggs. These undergo 4 larval instars which last only about a week in tropical countries, while 2 to 4 weeks in cooler climates. While their pupal period lasts 2 to 3 days in tropical countries, but sometimes as long as 1 to 2 weeks in cooler climates, after which the adult mosquito emerges. Most Anopheles are crepuscular or nocturnal in their activities, which I can partially relate to as I'm always awake at night. Kidding aside, their blood feeding and oviposition occurs before sunrise, after sunset, and at night. Some species, such as the Anopheles albuminus, a malaria vector in Central and South America, bite people mainly outdoors, known as exophagic. In contrast, African species of the Anopheles gambiae complex, which contains probably the world's most efficient malaria vectors, bite mostly indoors, also known as endophagic. given this, they are also both exophilic and endophilic, which makes it very hard to veer off their way. Going back to my experience with mosquitoes. Although Anopheles mosquitoes are not the vectors of dengue and chikungunya, they are the vectors of malaria. They transmit 4 parasites: Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium avale that cause human malaria. Now remember that there are 484 species of this genus. Only 70 of these are malaria vectors and probably only 40 are important ones. According to the World Health Organization, there have been an estimated of 229 million cases and 409,000 deaths due to malaria worldwide in 2019. Meanwhile, the Department of Health reported 6,120 cases with 3 deaths in the Philippines in 2020. With such high numbers, it reminds us of the importance of learning about the control methods for this mosquito. Many control methods have been available for Anopheles. These include residual house spraying and insecticide-treated nets. However, for larval and adult control, DDT and other organochlorines became the main strategy for the malaria control program in the mid-1940s. According to WHO, DDT is the most effective and safe for house spraying. If properly used, larvicides can reduce the transmission of malaria by up to 90%. Now that we know this, we are able to further understand the world of mosquitoes. And I am hoping that the knowledge that I was able to share to you can be one of the reasons that you stay safe from diseases these insects carry, so that you do not have to experience what I did years ago. Once again, I am Mary Catherine Angelica Lacap. Thank you for staying tuned in my Anopheles Talk.